Good afternoon, everyone. Thank you so much for taking the time to join today's webinar. We apologize for some technical difficulties, but ready to go. Today's webinar is Unpacking Test Automation, How to Innovate and Save like Novant Health. And before I get us started, I just wanted to take a moment and introduce our panelists. Today we have with us Ryan Neaves, who is the Vice President of Care Applications at Novant Health. He has the primary responsibility for clinical EHR and related integration applications. And Ryan, we're so happy to have you. Laura is our Chief Executive Officer at SureTest. She brings over 30 years of healthcare industry experience and is a strategic leader specializing in client services, global consulting, and acquisition strategies. Thank you, Laura. And
thanks, Kayla.
So good to be here.
So good to be here. Great to be here with Ryan, my fellow Red Sox fan, even though we've both been distressed the last couple of days.
Indeed. Indeed. Happy to be here as well.
Thank you, Ryan. All right. So thanks, Gayla. And again, our apologies for some technical difficulties at the front of the call, but we're really excited to talk to you today. And I'm so excited to be here with Ryan. Ryan and Novant has just been a phenomenal partner, and we've been so thrilled to follow them on their automation journey and watch over time the benefits that they've experienced. So today we're going to go through their journey. You're going to hear a lot from Ryan. We'll talk a little bit about our partnership and the SureTest solution that we're bringing to the market and Novant has been experiencing over the last couple of years. We'll talk a little bit about just tips and tricks that the solution gives you in terms of compliance and really giving you confidence that your entire automation journey and test automation experience can be documented and step by step be available for any quality and assurance that's required. Then we're going to give you a little tool to help you think through what your current spend is on your testing today and talk through the opportunity for an ROI. And then we'll have some time for discussions and questions. So Ryan, I think it would be great if you would just take a few minutes to talk through kind of the problem that you were experiencing at Novant and the things you were struggling with. And let's talk specifically about you as a client and your particular experience.
Yeah, absolutely, Laura. So really our journey, I would say, from a testing automation standpoint, it truly started, I think, when we made a switch, circa 2010 to a new EHR. And what we did is we kind of modernized, went to a widely recognizable vendor as far as EHR is concerned. And we really increased the complexity, as it were, whenever we made that jump. And so as we went down that pathway, of course, we realized that we really had to bolster up that entire QA element in terms of what was being built. The system that we utilize, and like I say, it's one of the big two, I would say. And so it's one of those things where we really increased the breadth of how deep we could go with this in our system as well. There's multiple ways to complete the same workflow. And so we really had to increase our capacity in terms of the different avenues that we tested as we built things in the system itself. And so with that, we started looking for ways that we could automate. At that time in 2010, we actually went down the pathway of trying to find 2 and 3 different solutions, as it were, and were unsuccessful. And basically the answers and the excuses we would get were, the system's just too dense to really be able to handle. And so we kind of pivoted at that point, always keeping in the back of our mind testing automation, and just staffed up and brought in a specific group that was devoted specifically to QA and really testing and what have you. And from there is where you start seeing, on the slide here, I know it says 8,000 to 20,000 hours annually on manual testing activities. Well, that's where we were we had a full staff that was specifically devoted to that. And we had them coming in every single day running scripts, and running them 2 and 3 times. And then what happened is, and just to kind of further kind of frame this, is we actually, from our vendor, we changed from a yearly cycle where we were doing upgrades to a quarterly cycle. And that really necessitated that we change our approach, and that we really drill down on this and figure out, hey, is there another automated solution? And that's really kind of what led us to SureTest. At that point, it was Santa Rosa, but and with SureTest is really kind of where we've been able to find a way to really complete exactly what we wanted to complete from the very beginning.
Yeah. And Ryan, don't you find that in terms of the problem, I mean, we're seeing this with a lot of health systems that have moved to more sophisticated EHRs like an Epic or a Cerner, and there's already so many demands from a cost perspective. I think everybody that implements Epic increases their staff. If you want to get the upgrades and you want to take them quarterly, there's a level of diligence that's required to make sure that you're doing good functional and integrated testing, and the effects to all your downstream systems as well. And it just has put, clients, I think, at more risk by doing inadequate testing. And that's my take.
Well, one of the things that I'll add there is, in what a lot of times happens, and I see this a lot, is you buy an Epic or you buy a Cerner and you staff up to build out this EHR in the way that you want it to be built, and then QA is almost an afterthought,
right?
And you realize, well, hey, I've already put up this huge outlay. We can't, we're not going to put out more of a expenditure to build up this entire QA program. So what you end up with is build analysts are the ones that are doing that testing.
Exactly.
And these aren't, they're not specialized, and they're not really, it's really not their niche, in terms of of what they should be doing.
And they don't like doing it.
No, they don't like doing it. That's right.
And, they want to be working on more strategic things. And I think when you think back to 2010, upwards until the last couple of years, when you guys were trying to get this off the ground yourself, you wanted to be, and you have become, not certainly just because of automation, but because of all your strategic initiatives, a leader on strategy and on automation. And, in talking to everybody at Novant, there was this shared vision from your leadership team that you wanted to get to the next level of innovation, which I think is why you guys were driving so hard to try to make this happen and be more efficient for your landscape and for your communities, quite frankly.
Yeah, I think that's exactly right.
Yeah. So, let's talk a little bit about Novant's success story, and I'll let you kind of walk us through this, since it's really your story. And I have to say, kudos to Ryan. He has been, and Ryan is a guy that just doesn't self-promote as much as I think that he should, but he really has been the cornerstone and the driving force behind this program, and has just done a phenomenal job from my perspective.
Yeah, well, thank you, Laura. Well, so, I think, in terms of our journey, we had this staff, we had 10 to 12 FTEs that were every single day coming in and just running test scripts. And then we happened to find Santa Rosa. And at that point, we started having that conversation, which, and just the name is SureTest today. At that point, we started talking through the solution that was really kind of being brought to market. And it was really kind of actively at that point being built up and starting to be marketed and what have you. And we started talking through exactly how this would look. Well, we talked through the actual automation software. We talked through exactly what that's used for. The fact that it was used for NASA,
right.
And so that kind of speaks to the fact that, there's not going to be a lot of mistakes that happen as you take it through that automation standpoint. And so as we started talking through that, we realized that this could be something much bigger than anything we had really kind of gotten into before. And we realized that the technology that SureTest was bringing was a caliber above what we had seen before. And so we went ahead and decided, we kind of bet on SureTest and brought them on to start in that automation journey. And as we went through that, it was very much a regimented schedule, I would say, that we went through, where we brought our analyst in, and the motivation that we gave them is, hey, if you capture this once, you don't have to capture it again. You don't have to run this test script again. And so we brought them in, we captured the test scripts that were in scope at that point. And really the success that we had subsequently all kind of looks back to the fact that, one, we were able to capture those effectively. We had the right folks involved from a SureTest perspective as well to help us to make sure that we captured the right pieces and parts. And then we could string all those together into our integrated testing, as it were. And as we did that, the real value proposition came as we really put it to the test. We had an upgrade that was coming up, and we basically told SureTest, this is going to be your dress rehearsal here. Let's capture all the scripts that we need for this upgrade. And we really put it to the test. Whereas before, we're testing once or twice maybe to make sure that the functionality works. We were able to test our test scripts 50 and 60 times prior to upgrade. We were able to catch a lot of bugs as we went. I'll mention that, and make corrections. And, just in terms of the payback that we got on that is, number one, we didn't see that we had to keep our command center open. We had a kind of a functioning command center after every single one of these upgrades. We were able to close it after 48 hours. We didn't have any of the testing issues that maybe we'd seen previously. And we were also able to just kind of iterate and continue to change. And it's just grown from there. I'll say we've grown, and we're at about 60% of all of our EHR-based scripts are automated at this point. And we're looking to further expand to bring all the scripts that are in scope in as well. And so able to audit immediately. And then two, that QA staff that we had, we were able to repurpose to other areas where maybe automation wasn't, where we weren't able to automate at that point. But even today, we're starting to look into those areas to see if we have an opportunity to use SureTest in those areas as well.
Yeah, and just by background, just to kind of set the stage, Novant was at the time, as Ryan mentioned, Santa Rosa. So our test automation program, which has now been carved out as a completely separate company because of the success that we've seen in the market and the demand for this service, quite frankly. But previously, it was just a business unit, within Santa Rosa Consulting. And Ryan and Novant and the entire leadership certainly took a bet on us, and we've had a lovely partnership. They were our first pilot customer, and really worked through a lot of the tweaks to the solution and to the program, which is now fully deployed, fully developed, and we can get to 80 or 90% automation. I think that with COVID and the number of priorities that Novant had, we focused on some of the core pieces of the EHR, and now we're looking to do that expansion. And like Ryan mentioned, even look to other surrounding systems outside of the EHR. But the other thing that I think that I would mention in terms of these 10 to 12 people, I think it was 12. I think in retrospect, if we look in the rearview mirror, we probably would have said, let's keep one there for coordination and liaison. But all those people have been able to completely be disbanded from that QA group to now work on far more strategic initiatives. So we've really enjoyed the great partnership that we've had with Novant. And Ryan's absolutely right. We told folks, if you give us, 15 minutes to record your workflow so that we can capture it to move it to automation, you're not going to have to do testing anymore. And everyone raised their hand, pretty quickly. So that, I think that worked out really, really well. And now just the ability to take all these upgrades on a regular basis, I think has just been a game changer.
Yeah, absolutely. I think it's one of those things where we've just embedded SureTest into the actual review process at this point. So we get our release notes for our next upgrade. We embed SureTest into that, and any modifications that we need to make just happen kind of in real time as we go. And that's allowed us to just stay on top of it as we went. I mean, I'll say the initial setup on it, that to Laura's point, it was, each of our different modules had 15 minutes where they captured their major scripts. And then from then on, it's just been this rolling machine that we've just continued to feed as we've gone.
Yeah. So thanks, Ryan. And we've been so excited to share in this success. And, the one thing that I think is really important to note, if you think about what healthcare has gone through for the last 2 years, and quite frankly, when we were faced with COVID, just like we saw our clients being faced with COVID and all of those impacts, it's one of the reasons why we really decided to double down and invest in our automation program and carve it out as SureTest, because we saw firsthand what our clients were dealing with. They were exhausted. They were overwhelmed by all the new demands that were coming on them. The costs were exorbitant. We now had folks working in remote environments, which, healthcare had been slow to adapt, certainly from my perspective. And if there's one blessing that came out of COVID to me, it's that I think we caught up with so many other industries and that we were able to work more efficiently. But when we looked at the landscape, we said, the days of staff augmentation or the days of doing a strategic plan or a system selection. I mean, I think over the last 20 years, clients have gotten so sophisticated, and you have such phenomenal leadership that what they really need is something that's going to give them an ROI, real ROI, going to save them time and money. And we saw the opportunity with SureTest to do that. The other thing I want to mention that Ryan said in terms of the solution, we went out and surveyed the market and did an exhaustive set of research on what would be the best tool that we could package with our solution that could really handle the components of an EHR. So if you think about a workflow or a clinical journey and the number of ways that workflow and that journey can go. And that's why at the cornerstone of our building, we selected Eggplant as a partner. And that is the automation tool that we use with our library. And that, from our perspective, based on exhaustive research that we did and the money we invested to make sure we were picking the best partner, I think is why one of the key reasons why we've seen Novant go from being able to not get this off the ground, but be able to really couple it with the overall solutioning and the maintenance component, other things that we can talk about that I think just makes a huge, huge difference. So when we thought about COVID and we thought about what our clients were going through and how exhausted they were, and think about talent management, and especially today being able to attract talent now that people can work anywhere, we believe that this solution really does increase employee morale. And at a time when our clients continued to be, so stressed, we knew how important it was to give them something that was actually going to relieve them. Because we felt it for them. I mean, when you've been in the business for as long as we have, and you have deep relationships with clients, they're an extension. You feel their pain. And I know for me personally, it was very important to bring a solution to market that was going to be able to make a difference. And I think, Ryan, even when we were going through COVID, there were some specific COVID workflows that we were able to quickly automate.
Yeah. Yeah, and yeah, that's exactly right, Laura. I mean, we've put a number of different things in, everything from tele-ICU to the increase in video visits to, the inline communications that go along with kind of at-home monitoring for COVID and what have you. And so it's one of those things where we put a number of workflow, and then of course, everyone on the call can sympathize with the fact that we get a new version of our vaccine that we have to do every other month or so. And so it's one of those things where we're just continuing to iterate and continuing to build upon that. And I mean, it's very nice whenever we can capture that and then just continually test. And then really all we're testing are the modifications we make, as opposed to trying to test something end to end all the time. And so that's been really nice. One of the other things, and you brought up a good point there, Laura, in terms of efficiency amongst your staff, as it were. One of the, I think everyone, and any of the leaders on the call absolutely can sympathize with the fact that we're in a talent war, as it were. Mm-hmm. By kind of the COVID-19 impact that we're seeing is everyone is able to work from home. Everyone can work I can work from across the country, et cetera. So it's really opened up a lot of our doors to new talent, which is an awesome thing. But also what we're seeing is that folks have more options available to them, and they maybe only want to do what we're hiring them to do, and it's one of those things
testing's
where,
not that, right?
exactly, and testing is not listed in that job description for our build analyst.
Right.
And so it's one of those things where I think it does give us a competitive advantage in the fact that, whenever we onboard our new build analyst, we're really expecting them to build,
Yeah.
and that's what we're looking for them to do. And they have the ability to choose now, where they can say, well, hold on, if I'm going to be doing less meaningful work to me, and I'm going to be testing and doing this, then maybe the position isn't right for me. Well, we have a solution that allows us to, really minimize the time they're going to spend testing.
Yep, absolutely. And, if you look, I have a note here. We recently saw an article in Fast Company, folks that like what they do and are able to really leverage their strengths as opposed to, mundane kind of button work, if you will, are 73% more likely to stay engaged, 50% more likely not to leave. And I love the fact that, they're more likely to receive, customer satisfaction scores. So to be able to take that mundane work off of an organization is something that, we've been really thrilled to see. I mean, we have analysts tell us all the time, oh my gosh, I'm so happy I don't have to do this nonsense anymore, because, testing is a cornerstone. It's so important. And if it's not done well, it can cause significant issue, but nobody likes to do it. And, this partnership and this solution, allowed Ryan and his leadership to be able to say, we've got a win for you. And that's, I think that's been positive. And the SureTest solution, from selling it, engaging in it, recording the workflow, doing all the development and all the maintenance, is completely remote. We don't have to step on foot at all, which is another cost savings. If you think about in the old consulting days, the amount of cost that was associated with flying consultants. So another reason why we wanted to get this to market. And if you look at the solution, I'll talk a little bit about SureTest and kind of what we've done different, what we think we've done different. We're excited that a class report is coming out on Friday that's going to talk about our solution and our clients. And I think that when you get that report, you'll see that our approach to really getting a client to automation and automation quickly is very different than what we're seeing in the market, and certainly than what they have the bandwidth with all their competing priorities to do themselves. So if we think about a health system, it's very complex. If you think about a large tree, all your patients are moving up through the tree, like the tree's nutrients. And the tree is going to provide health and life to everything that's flowing through that tree and that organization. And whether you're working with the EHR, other third-party applications, the connection points amongst the tree, are important. And what we've seen in our experience is that hospitals right now run these very labor-intensive, linear, redundant tests from, the roots all the way up to the branch. So what you end up getting are all these convoluted and in multitude journeys, really represented here in terms of the journey that any patient can take, and they cross over left and right. You might need to add a branch, and if you do, you have to create a new test scenario. It's typically done very, very linearly. If you think about how all the patient journeys across a health system cross over. And so what we did is we were very specific in our approach and in our strategy. And what we said was, we want to create a framework that is plug and play. I liken it to Lincoln Logs. We understand all the vital workflows and components that an organization has. And what we did is we built out a framework. We built out a library that has now about 2,000 of the typical workflows that we would see across an EHR. And primarily we're working in Epic and Cerner. And what that kind of framework does, and what we did is we created a library that is very plug and play. We know that, patients are going to come in, there's only so many ways to register a patient. There's only so many ways to, do a clinical documentation on a patient, et cetera. So what we did in terms of this library is we created a library that was going to be very, very plug and play. And, here's an example. If you think about just an outpatient office visit, and please let me just say that I understand this is an oversimplification, but we do that with purpose to kind of show how these things come together. But if you think about a typical outpatient office visit, the patient makes an appointment, they get checked in, the patient has to get room, documentation happens, et cetera. It goes to billing and claims. And that would be a typical, outpatient journey. And then if you look, and again, a little bit of an oversimplification, what we do at SureTest is we built a library that we understand where the common workflows are. So in this example, it is a labor and delivery patient journey and an emergency room journey. So you see that, the patient had to come in, they were arrived, they were triaged, they were admitted. They may have been admitted to the hospital through the emergency room. And in the labor and delivery example, they were admitted to go have their baby. They have some separate things that are going to happen along the way, as you would treat a mom and a baby differently than you would treat an emergency room patient. Either they might be discharged, they might be admitted to the hospital. But then at the end, every chart needs to be coded. Everything needs to have a charge review. Everything needs to go through the appropriate billing and claim cycle. And so what we've done is we've created a library that allows for tremendous efficiency of the automation. So it no longer needs to be done in a convoluted yet linear, overlapping every patient journey way, and allows us to really streamline the testing, but to do it in such an efficient way and at such volumes that you're doing continuous testing. At Novant, we're testing every day. We're running scripts every single day. And some of those scripts might be 5 to 7 days because, of course, we want to see what appropriately happens to the claim. So it's a very efficient approach. And so what we did is we took our library, our SureWorks library, which we spent a lot of money and time creating based on developers that not only know Eggplant and have a lot of experience in testing, but that also are Epic, in this case, certified. We also have a team of very strong Cerner. Cerner doesn't call it a certification, but that have expertise in Cerner. And so their ability to kind of weed through the muck to make sure that we were creating very efficiently this library, which is an extensive collection of these automated test scripts. And what it does, we bring that library to the client. Now, Novant didn't have as much benefit of that because we kind of worked on our library with them. They're getting the benefit now as clients get added. I'll let you speak.
Yeah, I was just going to say, Laura, just to give kind of the boots on the ground perspective on this. So, what we've seen over time with SureTest is the buildup of that library has been especially beneficial as it comes to version upgrades. Because what happens is we're for a long time we were right on that razor's edge of innovation. Well, COVID's kind of thrown things all over the place for us. And so what we've been able to see is, other organizations that have already gone live with the version that we're looking at, we're able to then benefit from that because we can say, okay, here's new functionality that was added. Here's new test scripts that have been added to the library. And then working with SureTest, we're able to then say, we actually have a coordinator, a testing coordinator with SureTest that then just kind of picks and chooses, hey, here's all the new features it looks like that came out according to this organization or that organization. And then we're able to kind of weave that through. And so it's really, it's one of those things where it's a great idea in my mind because it allows us to, as a community, benefit together. And if you're just getting started, you can draw upon the fact that there's all this entire library that you can use to get kind of the
jumpstart,
the ball rolling, as it were.
Yeah.
But then also, if you're in a position like ours where you've been doing this for a while, we're able to benefit as well, because anyone that kind of innovates and puts a new test script out there, we can take advantage of that as well.
Right, exactly. And that was the whole, really our strategy behind this, is to find a way that our clients could benefit from each other, but that they would also have their own persona engine, so that if for whatever reason, I mean, we believe that when you think about the maintenance costs, it won't be worth it. But if you decided over time that, hey, I wanted to bring this back in-house, I'm going to go get a bunch of developers and I'm going to keep them in-house, every client has their own SurePersona engine. So every client owns their own test scripts, but at the same time, they're able to constantly benefit, so long as they are a part of our program, in the overall ever-growing vast library across the EHR and other third-party applications that can come into the library. So there's a SurePersona, what we call the SurePersona engine, which is the client's specific workflows. And then there's that ever-growing constant library that they can draw on at any time. And, of course, the framework that we talked about is what I think is so important, because it's alive, it's rigorous, it's ever growing. And because we are working with the clients on their Nova notes, like Ryan said, we're looking and seeing and knowing what is the next piece that's coming in, the next upgrade, working with our clients. Are you going to take this? Yes or no? This client already took it. And before you ever get to the upgrade, your test scripts have already been maintained and updated. And that's really kind of the beauty of these three features that we bring together. So Ryan, I'll kind of let you talk a little bit about just some of the other benefits that that you've seen in terms of optimizing staff.
Yeah, absolutely. I mean, and it's kind of the things I've already said in terms of, so we're pulling our build analysts that were highly involved are not nearly as involved. I mean, one of the other benefits that we've seen is, as I'd mentioned, as we're walking through this, we're actually finding software bugs that are 2 and 3 test scripts removed from or 2 and 3 iterations removed. And just as an example, I remember we were testing for one of our upgrades, and we were seeing, we saw an error that was popping up. And we of course took it back to our vendor and we said, hey, we're seeing this error. And they said, that's interesting. We haven't seen it reported, but you guys are early in the sequence, whatever. So we did a little bit more forensics using SureTest, of course. So we ran the script again, no error, ran the script again, no error, ran it the third time, got the error again. And what we were finding is bugs that will only manifest themselves if you're running this at volume, as opposed to, as I'd said earlier, with our manual testing group, we're running test scripts once or twice, maybe before it hits production. Well, now we're running it 50, 60 times, which is, by extension, giving us a lot more data and giving us a lot more perspective, as it were. And so that's one of the benefits, I would say. I mean, the time savings in terms of not having to put as much time and effort into command centers, as we had mentioned. And then, of course, just the overall ROI in terms of just the staff that we had devoted to this are now reallocated to other items. So we're able to move, with greater velocity on other strategic initiatives. That's, obviously that holds some value, but then also the fact that we've been able to replace, that salary in this specific area with an automated solution, I think is also another area for ROI.
Yeah, and I think that's a really important note that you make, Ryan, because one of the things that's the beauty of this is we are testing this at the user level. So we're not going into the code of the system. So we're not touching, anything that the vendor does underneath the covers, if you will. It really is how the system responds and the user, based on their interaction, performs, which is really, at the end of the day, what you want to make sure that you're testing. So if you do it with a keyboard and a mouse or a click, we can record it and develop it and automate it. So you're really testing the user experience, the patient experience. Even I know when you think about my chart and doing an appointment with a patient, the system has the ability to leave the EHR, go out to the web, let the patient go out to their My Chart, see what their doctor is saying that they need a follow-up appointment. Then it comes back into the EHR, because what it's doing, it's emulating those keystrokes of a patient, those keystrokes of a clinician, of a registration clerk, of a billing clerk, of a phlebotomist, of an X-ray tech, etc. So, that really is the beauty of this, is that you are testing at every persona, along the way. And the ability to have every single thing that you do documented. I mean, we have one client that is printing it all out for Joint Commission. It's something that was important to them to be able to really document and show that they did adequate testing. And literally every single thing that is done is recordable in a dashboard, able to be printed out if you want to, or just, the general QA that you do.
Yeah, and I mean, and even if it's not for, an audit or a Joint Commission survey or something like that, that you're printing those things out for, one of the ideas that we've had and we haven't gotten to the point of implementing that, is the fact that we can leverage all of this from a from a training perspective as well. Yeah. Meaning, the screenshots that we need, the real kind of from point A to point B workflow that we need, we can capture every single bit of that utilizing the Eggplant software. And so that allows us, we haven't gotten there. I really want to push us to get there, though, because I know that's going to increase efficiency. It's going to allow us to grab all the pieces that we need to throw together training documentation as we go as well.
Yeah, absolutely. We actually have one of our clients that is starting to work on that, Ryan, where they know that we're recording the workflow. And since you're recording the workflow, and the really cool thing, and I think we saw this with Novant too, is the way that those build analysts thought that the workflow was happening out in the field, and the way that it's really happening, because people want to find ways to do their job easier. So they're always going to find workarounds. So the opportunity for optimization, I think, has been phenomenal. We've seen that across all of our clients, but, to have the ability to really record step by step what an end user is doing, capture that, and then package that into e-learning is just an extra value add that's of no additional cost to the program, but that you can benefit from.
Yeah, absolutely. And it's one of those things too, where I think I'd mentioned this early in the presentation here, that there's 2 and 3 and 4 and 10 ways to do something in these systems. And so it's one of those things where, we were testing in a very linear fashion, where we say, we have our one happy script, and if we get all the check marks on that one script, everything's good. Well, then we go and talk to our clinicians, in the facilities, and they say, oh no, I never do it that way. Right. I do it this other way, and then I do that, and so it's allowed us to capture all of these different pathways that you can go down as well. So yeah, that's a great point.
Yeah. And I think probably what's most important is just the amount of rigorous testing. You could never do the amount of testing that an automation solution can give you. I mean, we're testing 24/7 sometimes. And, just the sheer volume of that to really eliminate the risk that's sometimes caused by insufficient testing, because it becomes the last thing on the plate. You get so many other priorities and nobody wants to do it. The reality is, if nobody wants to do it, it typically doesn't get done. So that's been cool to watch for sure. We've talked about the efficiency and the cost savings. As Ryan said, they're about at the 60% of their journey, soon to be, up to 80% of taking what was all the manual testing activities and getting them to automation. For us, and of course, we've gotten a lot better over time, Ryan. You were our first pilot customer, but the speed to value is just phenomenal. So as we do automation, we're deploying it to our clients. So within the first few weeks, you're getting automation, and we're seeing the ROI, and we'll talk about that in a little bit. Pretty extraordinary. Like Ryan said, imagine 12 full-time people no longer having to be testing, redeployed to more strategic initiatives. And, the level of efficiency, just in terms of having the detailed step-by-step workflow, now processed electronically to be able to use that for training and clinical validation and for audit purposes. So if you look at the little wheels there, you can see kind of where they were, where Novant was, and kind of where they've come in terms of the spokes on this wheel.
Yeah, absolutely. I mean, I think it's, you know, and I know you're going to go there as well, Laura, but the cost of entry for us, you know, validated us taking the test, you know, just putting it to the test, and what we've seen is, you know, obviously these aren't our specific numbers, but it's one of those things where you know, we're right in line with, you know, the figures that are being shown right there.
Yep. Great. Thank you. And then, you know, just some of the tips and tricks to be able to establish real metrics and produce documentation and dashboards, to be able to audit immediately anything that could have gone wrong with a script or the reason that a script failed, I think has just been a big win. But probably the biggest thing that I feel Novant has benefited from is the maintenance program, because they no longer have to worry about if a change comes in. It is the responsibility of SureTest to constantly retrofit the scripts to match and to work and to be able to be adequately tested with any of the new releases that come out. Whether a client is choosing to do 3 a year, 4 a year, you know, we see so many clients going through acquisition across the board. So not only were they dealing with the 4 upgrades they want to do a year, but all the acquisition testing that needs to happen with acquisitions that are, you know, migrating to, in most cases, you know, a unified build, and being able to leverage and make sure that the testing program is going to work in, you know, in other environments. So, you know, one of the things that we're going to give to everybody today, and I know there's a lot on this screen, and Gayla is going to help you work through. You can actually download this document. We wanted to give you something that you could work with, and if you, you know, fill it out and get it back to us, we will give you your own personalized ROI calculator. We've spent a lot of time working on this, but essentially what this download will give you is it will show you very specifically where the components are in the download. And if you look at this example, so this is an output from the download, and the blue areas on this screen, you know, highlight the data that we ask a client for, because every client is different. This is for a specific client that we did an ROI for them. And so we look at the average salary of the folks doing the testing. We also look at the average salary of the subject matter expert or the builder, because what's interesting to us and what we found through this process, it's not just the testing through the upgrades, but we find, and we were very conservative in this, when we surveyed, you know, about 8 clients, they told us that their builders are spending, you know, an hour and a half to 3 hours a day just testing the things that they build on a go forward basis. And so we put that down to just an hour. So over and above the regular test cycles and the acquisition test cycles, but just the day-to-day testing that analysts are doing, we ask you for that information. And in plugging in things like the number of employees that are working on your test scripts, the average salary of those folks, we assume some benefit load, right? Because, you know, it's not just the person's salary. We also look at PTO. We look at the number of test cycles per year that somebody is doing. If there are any other special test cycles that you do, whether or not there's dedicated people, and then how much time they're spending per test cycle. So what we found is that between keeping the scripts updated, documenting your scripts, you know, constantly retrofitting them manually, plus the time, the 2-week blocks that are usually, you know, kind of blocked off as you go through these upgrades, you know, on average, it all rolls up to about, you know, 6 weeks we're seeing in a cycle where people are working through these scenarios. So what this tool does is it allows you to plug in all your personal data based on what your hospital is experiencing today. And it comes up with a very, very specific, ROI and an output that you can use to cost justify the program. Because when you look at the general cost of the program versus the amount of money that's being spent manually to do these efforts, it's pretty extraordinary. So in this example, what we did is we plugged in, and this is for a very specific client. This was their data, not ours. They gave us this data. And basically what you see here is the cost that they're spending, and they didn't even realize how much they were spending a year, the number of people that were working on testing. So if you look over 5 years, so in year one, this client was spending about $1.6 million on just basic testing. And we didn't even take into account if they were going to do rigorous testing the way we're doing it. We were measuring just the basics that they're doing today. And we looked at that. And then we looked at the cost of the SureTest program. I will say this cost here that's here in year 1 through year 5 is for a typical large academic medical center. So if you're a smaller hospital, the price may be less than that. If you decide you want to get to more than 80% automation, this is based on about 80% automation. And we say 80% because there's some things that it just doesn't make sense. It's not worth the bang for the buck to create a test script around it because you only do it, so often. But if you look at this and you look at what the return is, I think you can see that the value achieved through automation is pretty extraordinary. And if you look at the return on investment from both a dollar and a percent perspective, and that's why we're so passionate about this, because like I said, we really decided to take this from a business unit, within Santa Rosa and build it out completely separate as a company when we were watching our clients suffocating, and I mean suffocating, from COVID and the emotional and the financial stress that was on them. And we wanted to price it in such a way that they could see immediate ROI. And by having a development team that we have, brought on board over the last 2.5 years that not only are experts as test developers, but also certified in the EHR, we're able to just get through the muck to the other side very, very quickly by leveraging this now library that we have as a jump start. So the ROI really does become pretty extraordinary. And Gayla should have, put this up. I see where you can download the actual, the actual form. If you're not in a place where you can download it, we will certainly send it out to all the participants, so that everybody has it. And I wanted to make sure that we had left at least 5 minutes or so for questions. So Gayla, I don't know if you want to instruct on how to do questions to everybody.
Questions in the chat screen, and we will address them. I've got a couple questions already submitted.
Okay.
The first one is for Ryan. Ryan, how much time did your staff have to spend working with SureTest during the implementation?
Yeah, so it was split up into multiple sessions. I could probably get the actual number of hours, but I would say that for each module, probably what you're looking at is they spent about an hour with SureTest, just capturing those initial scripts, and then subsequently, I would say we probably spent, after the fact, and this is all kind of in line with our development strategy to keep rolling out, later versions and what have you. They're probably spending 10 to 15 minutes, as a group, just updating and making sure that it's truly just a matter of, hey, are you going to take this or not? And we say yes. or no or whatever. So
yeah. And I would just add to that. It's I think what we saw certainly with Novant, there was the initial, gathering the scripts. We've actually gotten even more efficient than that since we originally did that, Ryan, because I know we came on site to do that. Now we're actually recording them in the video session, so it's really, really quick. You're not having to pull people away. We have a very specific methodology to schedule it and get it done very, very quickly. And then the validation. So once we do the development, we then show you the validation to say, did we in fact capture everything you told us? So you're watching the development and the validation of what you told us happen in real time in automation. So there's a validation component as well. But yes, I would agree. What we're seeing is we typically have a liaison that we work with. We have a bi-weekly call, and it's quick, 15 minutes to a half hour, every other week on a call. And not with all the analysts. We have a liaison to do that. And then quick questions here and there. If there's something that we have a question for, that's typically dealt with over email.
Thank you. The next question is, does it integrate directly with Nova release notes?
Yeah, so the process that we put in place is, I believe it does directly. Well, our process is just a little bit different, where we actually have just kind of a all hands on deck representation from every single module, where we do a kind of a full scale review of our Nova notes as they come in. And we include SureTest into that. So essentially, whatever decisions are made in that meeting, we have representation from SureTest in that meeting to make sure that that makes it to our test scripts.
Yep. So, and I'll just add on that, just for other clients, Ryan, just for everybody's benefit and who's asking the question, is that yes, we know what's coming down the pike in terms of the Nova notes, because as Ryan mentioned, some clients are ahead of other clients. But what we've done is every client is given a dedicated person that is there. It's included in the price. It's not charging extra consulting dollars or anything, but there's a person that's dedicated to you as a client, logs on every day, to look at the system, make sure the scripts are running, deals with any issues, etc. Typically, that person is also a part of the change management process. So, when anybody makes a change, typically what we've seen with our clients, if there's an email distribution to change management, we're included on that email distribution list so that we are proactively, as we see that a change has happened, making that change to the test script. It becomes our responsibility to make sure that that script has been updated for any change management event, whether that be Nova notes or if, there's always optimization that's happening at an organization. So we're a part of that process.
Thank you. And the next question that we have, probably the last question, unless something else comes in, is what happens when we have specific workflows that others don't have?
So I can tell you, we get that question all the time. We have I'll give you Epic as an example. So every application that exists within Epic, we now have a workflow for in our library. If your workflow is so different, as a part of the price, it's our responsibility to customize it to your persona. Typically, what we see is that now that the library has gotten so big over time, that 9 times out of 10, there are at least some components of what's already in the library and been developed that we can stitch together with your workflow. But if you have a workflow that is completely separate than anything that we've ever done, if it's some specialty that nobody else has, whatever it is, we would record that workflow the same way we do anything else, and we would customize it specifically for you. It would become a part of the library in case another client, wanted to benefit from it over time, but it would be in your own persona and it would be dedicated to you. So we would just create that. I mean, we leverage the library where we can leverage the library, but if something's not in the library or it's so different, we just record it from scratch and develop it from scratch.
Awesome. I did get another question. Can it be used with third-party interfaces?
Absolutely. Absolutely. And quite frankly, what we've seen, one of our clients at SIH, there's a podcast that I did out there with Nikki from SIH. One of the things that they found is, if you have a test system that is a third-party system that has a test environment and the interface is pointed to it, all this data is going to go through the interface and it's going to automatically go to that test environment. And if there's not, an interaction that needs to happen, if things happen naturally, it's going to come back through the interface and go back through the EHR. So yes, it absolutely can be used. Anything that you can literally put your finger on a keyboard or click a mouse, we can develop.
Thank you. That's the last of our questions. Do you want to go ahead and close us out?
Yeah, we're right at 2:00. Ryan, as always, you're awesome. We love working with you. You've done incredible, innovative things for Novant. You should be really, really proud. I sure hope to God the Red Sox aren't going to disappoint us, and that maybe, because I know Ryan said he might be going to the World Series game in Atlanta, and I said, oh my gosh, I'm thinking of going too. So I'm going to put that out to the universe and hope we get to see each other there.
All right. Thanks, everyone. Please don't hesitate. If you have additional follow-ups, just reach out to me. You can either use the information you see on the screen or just reach out on LinkedIn.
Yeah, and
thanks, everyone.
I think that Gail is going to put that stuff out as well.
I sure will. Thank you so much, everyone. Have a great day.
Thanks, everybody. Thank you, Ryan. Take it easy.